Hey guys, Ross from Fit for Life Physical Therapy. So today I want to talk about simple massage techniques that you can do for tennis elbow. So the tennis elbow is something that a lot of us will get just from the amount of gripping activities that we do, whether it is from tennis or whether it's from using a screwdriver or sitting at a desk all day long, or in my case, manual therapy. So tennis elbow, if you've ever had it, really you're going to get pain right along the bone on the outside here. This is called your lateral epicondyle, and they used to call it lateral epicondylitis, and now they've changed the name to just lateral elbow pain. And usually it's just due to the repetitive stress that's accumulated over time, and then we start getting some micro trauma at the tendon. They used to treat it with rest, ice, compression, elevation, so the regular acute injuries, but they're finding out now that by the time we have this type of pain, usually the problem has been there for a long period of time. So when you start feeling symptoms in the region, and that could be with twisting and gripping activities, really want to start looking at some of the soft tissue. Something started pulling on the tendon, which started pulling on the bone. So, and that's going to be the muscles right through here. So if we really think about it, if the muscles are really as tense as they can be, there's no more pliability left in them, which then starts pulling on the tendon, which then starts pulling on the bone. So really it's just following right down. And this is what causes a lot of our regional interdependence or dysfunction with the kinetic chain. So all we need, just like all my other videos, a lacrosse ball works perfect. Again, you can usually buy these for $2.99 or $3.99. I tell people just bypass a tennis ball altogether, because that's going to deform and you're going to have to upgrade to this anyways. So all you need is a usable wall and a lacrosse ball. You want to get the ball right on the painful area, but we're going to be working all through this forearm region. And then I want to reinforce it. So I'm going to take the palm of my other hand and I'm going to push it right against the wall. So I really want to search and destroy. And then all I'm going to do is just move my hand around back and forth and really work through my forearm extensors. I'm going to get all the way up into the tendon where it really hurts. And really the goal is just to find anywhere that's tight. Now you may feel weird symptoms down into your fingers, and depending which forearm extensor you're pushing into, that could just be a referred pain pattern. So it's really nothing to worry about. As long as it goes away once you remove the pressure, then I wouldn't worry. Now, there's a couple different techniques that we can use. So you can just use the smash technique, where you're just pinning the tissue between the wall and your hand, and then you have the bones to really help to mash it down. You can also do what's called a pin and stretch. So if you found a really hot spot, you can pin it down, and then you can take your wrist through flexion and extension, 5-10 reps, really whatever you feel comfortable with, and then you just move to the next hot spot. Now, as we've talked about, and I started to write a post about this, really it's a three-tiered system, where we have step one is going to be the loosening, which is what we did here, and then step two is going to be the lengthening. In this case, we actually want to help to lengthen the tissue back up. And for the extensors, we're going to do elbow straight, wrist down. And what I'd recommend is pull from the hand itself. Don't pull from the fingers, because we can cheat and create too much finger flexion. So pull straight down. And this is where you're going to feel the stretch all through here. Now you don't have to hold it out in front of you. You can hold it down like so, but you'll see a lot of people start to bend the elbow. You'll still get some stretch from there, but we want to increase the lever arm so that it pulls right at the area where we're feeling the symptoms. If you have a true tennis elbow, you're going to feel it right at the site of pain. If you don't have tennis elbow, you're going to feel it more in the middle of the muscle bellies. So it's a very effective exercise for most of us, even if we don't have elbow pain, just because of the positions that we're in, especially if we work at a computer. Our elbows are bent at 90 degrees, the wrist is cocked back, 30 degrees or whatever it is to work on use the mouse or work on the keyboard. So everyone can benefit from it, but if you're already in a pain cycle, I would definitely start here. It may take 3 or 4 weeks before you're pain-free, but again, you're giving yourself the best chance at success for a full recovery. So give these a whirl, see how it helps. If you have any questions, just let me know. Thanks.